What if you are 32 and your AMH is 2.2 picomole liters and you're not in a relationship? What would you recommend that patient do?
Okay, so the AMH of 2.2 picomole liters indicates this person has got very low or critically low egg reserve. So, which means that again, same process, you need to repeat, do AFC, and then you need to repeat AMH and AFC once more. So, within maybe 2-3 months here, because this person is not in relationship, she's not trying to conceive now, and her AMH is not that low, 2.2 compared to the previous patient. So, and she can repeat AMH and AFC once more within 2-3 months, then establish her baseline egg reserve. So then she essentially here what 2.2 means, 2-3 years, this person has got functional egg reserve. So which means if she does not achieve successful pregnancy within 2-3 years or preserve her fertility by banking eggs or embryos, then her chance of having a child after that will be extremely low. So still she will be producing eggs quite likely, like we said in previous patient, even when AMH is non-detectable, but that period is it's unpredictable. So essentially she really need to focus either on having a child within 2 to 3 years or need to preserve sufficient amount of eggs or embryos so that she will have a good chance of successful pregnancy after 2-3 years. So here in this situation is after establishing egg reserve, she really needs to either do egg banking, egg freezing. So it's really difficult to freeze sufficient amount of eggs when you have such a low egg reserve. So AMH of 2.2 generally indicates her AFC will be like 6-7 in average, maybe a little bit higher and a little bit lower in some months because of natural variation. So probably if she does egg freezing cycles, she will get maybe 4-5 eggs per cycle in average. So for the age of 32, to get 95% chance of having a one child, you need to preserve approximately 30 eggs. So it's not easy to get 30 eggs. So which means if you get 4-5 eggs per cycle, you may need to do about 6 cycles or more of egg freezing cycles. In some countries, egg freezing is very accessible, affordable. You can do 6 cycles of egg freezing across maybe whole 12 months period. In some countries, it's not available or accessible in terms of cost. So it really depends on individual circumstances and healthcare settings of this person. So, but if she does embryo freezing, that gives her higher chance of successful pregnancy, and probably she needs less cycle. Why? Because attrition rate in embryo freezing is lower than egg freezing. And optimization of the cycle in embryo freezing is easier than egg freezing cycles. I'll give you an example. Let us say she's not in a relationship and she definitely wants to have a kids, and she can do if it is an option she can consider, she can do embryo freezing using donor sperm. So in donor sperm embryo freezing, let us say same situation, she produces 4-5 eggs, use fresh eggs with a sperm and create embryo. So let us say out of 4-5 eggs at the age of 32, when you use fresh eggs, very likely she will produce 1 or 2 high grade A or B grade embryos per cycle. So if she does like 4-5 cycles, probably she will be able to create like 4-6-7 high grade embryos. So that 6-7 high grade embryo, 6 high grade embryo gives her cumulative chance of 95% for one child. So let us say she did 3-4-5 cycles and got 6 high grade embryos, she can be 95% sure she will have at least one child, or maybe more than one children, because embryos are independent. Each embryo gives 35% chance for her age. So generally embryo freezing is a much better option. So for a number of reasons, probably she will need less cycles than egg freezing. Second, embryo freezing gives better certainty than egg freezing. Why? Because if you freeze eggs, we need to have make it 2 levels of assumption before you get pregnancy. First level of assumption is 5 of your eggs will become 1 high grade embryo. That's one assumption. Then each high grade embryo gives you 35% chance, 1 in 3 chance of implantation. Second level of assumption. But when you do embryo freezing, you do one step assumption before pregnancy happens, which is for each high-grade embryo you created, you have a 1 in 3 chance, 35% chance of successful pregnancy. So you don't need to make an assumption saying, okay, if I froze 30 eggs, I will get 6 embryos. That assumption you don't need to make, because it's already embryo has been created, and you just make a one-step assumption, and usually 1 in 3 chance of successful implantation, and you can be fairly certain if you have 6 high-grade embryos at the age of 30, created 32, when you're ready to have a child, maybe after 5 years, maybe after even 10 years, you have approximately 95% chance of successful pregnancy. Neither egg freezing or embryo freezing guarantees success, but if you freeze plenty of eggs, especially plenty of high-grade AB grade embryos, then you can have a high level of certainty that you're going to have a kids. Not 100%, but you can get a 95% chance of having a child. So AMH of 2.2 indicates this person has got time limit on their egg reserve. They have time limit before they run out of egg reserve. The best time for her to either have a child or preserve her fertility by freezing eggs or embryos is within the next 2-3 years. Then it becomes harder and harder and harder. So this is why she has to reprioritize her life priorities, whether it's education, profession, finances, buying accommodation or apartments. I don't know. Everyone has different priorities in this life, but they put a sequence, like my first priority, my career, and second priority, finance, third priority, finding right partner. So there's multiple different priorities. But when you have a low AMH, egg reserve, you need to rearrange your priorities. You may need to focus on fertility first, preserving your eggs or embryos or having a child, then focus on other priorities. So this is why doing egg reserve tests like AMH and AFC gives you very clear fertility timelines, and it helps you to reprioritize, if necessary, your future goals. If your AMH is high, let us say 25 at the age of 32, no, you can just carry on with your current plan and just keep monitoring your egg reserve by doing AMH and AFC tests every 2-3 years, and keep revisiting this question of fertility. But if at the same token, if your AMH is so low, then you may need to reprioritize your life goals and focus on fertility first.